Hello everyone, I'm Dr. Deepika Chauhan, Senior Consultant in Oncology Department at Venkateshwar Hospital, Dwarka, Delhi. So today we would be discussing about some important precancerous conditions. A precancerous condition is the one wherein there are abnormal cells which can lead to increased risk of becoming cancerous. These conditions are not yet cancer, but they carry the increased risk, and they actually are the warning signals from the body that these conditions later on can become cancerous. So today we would be discussing 4 conditions. So let's have a closer look at each of these. The first condition which I am talking about is oral submucous fibrosis. It is a condition wherein there is stiffening of the mouth. So this stiffness of mouth can be associated with oral cancer at a later stage. The warning signs here would be stiffness of the mouth or the jaw. Then there can be ulcers or white patches in the mouth. There can be difficulty in swallowing, and there can be burning sensation with spicy foods. The second important condition which we would be discussing is cervical dysplasia. Now, cervical dysplasia is presence of abnormal cells which surround the cervix. Cervix is the area which connects the lower part of the uterus to the vagina. Now, whenever there is cervical dysplasia, there can be some signs and symptoms like unusual vaginal discharge, bleeding between the periods or bleeding after sexual intercourse. There can be pelvic pain. So whenever we have these symptoms, we should report immediately to the oncologist. Now these conditions are associated with human papillomavirus infection. So currently we have a vaccination against HPV virus which can protect all the females against the harmful effects of this HPV virus. The third condition which we would be discussing is ductal carcinoma in situ. Ductal carcinoma in situ is early form of breast cancer where abnormal cells are found in the lining of the milk ducts. So this can later change into breast cancer. In fact, it can constitute about 20 to 30% of breast cancers globally. So the warning signs of ductal carcinoma in situ would be abnormal nipple discharge. There can be a breast lump. There can be unusual pain in the breast, and there can be change in the shape and size of the breast. The fourth condition which we are discussing is Barrett's esophagus. Barrett's esophagus is a chronic condition in which the lining of the esophagus, that is food pipe, changes due to chronic acid reflux, which can later develop into esophageal cancer. Now the warning signs and symptoms of Barrett's esophagus would be chronic acid reflux. There can be pain in the chest, there can be difficulty in swallowing, and there can be persistent weight loss of the patient. This World Cancer Day, let's take pledge to take good care of our health and do not miss any of these warning signals, as it could be a pre-cancer condition. The theme of this World Cancer Day is United by Unique, which means every cancer is unique, and it will take all of us united to create a world in which we look beyond the disease and see the person before the patient.